is on.
It's just your conversation. I have to write down the notes that Ellen gives me. Sorry, we can't say the name.
Wyatt on the set.
Welcome to the River Park Dental Show. This is Dr. Phing Saurer. Hello, Michael Morris.
Hello, Phing. How are you?
Good. How are you doing?
Good. I'm excited because we're back again, and I really look forward to these shows that we're doing.
I know you do. Every single week.
I actually learned some things that are important and also disgusting when we do these shows. and I think last week we were talking about oral cancer screenings, and I think I should have said, please don't be eating while you're listening to this. Like, it's important information, but like...
Yeah, but we're not showing any visuals.
No, but you're describing it. That's worse. If I'm describing a car accident, it's always worse than if you see it.
It's not disgusting to me.
No, but as we've discussed, you're a doctor. So you have 2 doctorates in this mess, and I do not. So I'm just saying for the average person like myself, it is not really, it's not that fun.
Yeah. Well, you could still eat a bagel, though, right?
Oh, I totally would do that.
Okay.
It was gluten-free. I would totally do that. Even our engineer, Jim, he's gluten-free now, but he also has a Sonicare toothbrush. So he's kind of getting all hooked up on all the healthcare trends with you.
See? Very inspirational.
Yes.
This radio show.
It's doing something for people.
Yes.
Yes, see. I would like to get into the topic of this week, which is tongue tie. And I think that people have heard that term and don't quite know what it means. And being that you're a doctor, you could break that down.
Yeah.
What is that?
Tongue tie, it's basically when you're born with an attachment that's underneath your tongue, and it holds the tongue to the floor of the mouth. And it's not abnormal unless it actually causes a problem, like for the tongue to go to the palate of the mouth. And specifically why this is important is because, especially for infants, that's where I treat it more, because it can affect how a baby nurses and eats.
Wait, you're saying there are people that actually have this beyond just infants?
Yeah, a lot of adults do.
Oh, I didn't know that.
Yeah.
So, but is that
so tongue tie is kind of like almost like the Wild Wild West. Like, a lot of the doctors, there's still some ENTs and pediatricians that still don't believe it's a thing. And so it's kind of a newer topic. It's not new, but it's still a small topic that people don't even touch upon.
So it's not something that's commonly diagnosed. Like, you could see it, but somebody might just let a oral surgeon or a dentist might let it go. So you have to look for it in a very specific way, especially for an infant. So sometimes people will just kind of look at the baby straight and just lift up a tongue, and that's not really a good way to notice, to see if they actually have That seems like 1700s, like Western medicine. Like, I'll just flip it up and I'll see if there's something there.
Yeah, but you really have to look at the back of the tongue to really see if it's tied. And the posterior tie is the worst and hardest to diagnose.
So when you're doing that, I mean, is this something that is common? Like, at what age do they first kind of get diagnosed? Or would you see a baby? I mean, would it be 3 months, 6 months?
No. The earlier the better. So the earlier the intervention, the better. I mean, they have tongue tie as soon as they're born. So I've seen babies 2 days out from being born. And, you know, when they're in utero, they're actually making sucking motions, and their tongue isn't going to their palate. So when they're coming out, they've already, and the mom tries to nurse, they can't actually form a good seal around their mom's breast, and then they can't actually nurse.
Right.
And you know, and it's painful for the mother. And you know, when you first have a baby and all you want to do is feed your baby.
Oh, and there's no stress either when you have a new
no,
baby.
You're not going
it's
through
totally
any
relaxed.
hormones,
Right.
nothing like that. You know, and then now here you are, 9 months out. You want to feed your baby and you can't, and that's like it's terrible. It's terrible.
But who would notice that first? I mean, would it be because I can remember when my daughter was born, I didn't even know that was a thing. It wasn't like there was, okay, let's get someone that deals with dental issues in here to look.
Right.
So your physician would have to look at that first,
it's the
right?
pediatrician that looks, and the ENTs, and unfortunately, I will say a lot of them don't believe in it because it's not something that's really taught in medical school. I think now that it's becoming more of an issue. It is something that at least, but it's still not something that people are really talking about. So when I had my 3 kids,
I didn't even know about tongue tie until after the breastfeeding was over for my last one.
Wait, you got through 3 kids, and then
2 of them were tongue tied. And then actually one was diagnosed when he was born, my first one, but he had an anterior tie. So those are the ones that are very obvious, where it's at the tip of the tongue. And those are easy because you can see that automatically. But it was done, I don't want to say, it just wasn't done all the way. So they only clipped the anterior part and not the posterior. So that really doesn't do anything. It was incomplete. And breastfeeding was very painful for me. It was, and I gave up on breastfeeding after 12 weeks just because once a baby cannot breastfeed, your milk supply goes low, and and you get frustrated, and everyone's like, just calm down and relax. You're like, I can't relax. This is very painful. But for me, I just thought that was normal. I thought pain was breastfeeding was supposed to be painful, and I could only go up to 12 weeks for each of my kids. But then after I took a course, and they were talking about tongue tie, and then all the symptoms that babies and mothers have, I mean, it did bring me to my tears in my eyes, because I was like, that's what I went through. So then I kind of just started doing more research about it.
I would think there's other people that are kind of having the same issue or had the same issue as you, because I've heard that issue with women nursing, that they're just not taking to it, or they're not getting enough, or whatever it was. And a lot of that probably could have been, if they were diagnosed as tongue tie. Right. Because what's the percentage that you think of children that are born that are tongue tied? I mean, I know there's not an exact figure because it's not being diagnosed all the time.
It's not being diagnosed, yes. I don't really know. I think I've read somewhere that they think 30% of babies.
That's a really high amount.
It is.
If you think about it. 3 out of every 10 kids has that issue, and if it's not diagnosed, that 12-week period that you were talking about breastfeeding, that could be an issue.
Yeah, and right now, you want as a mother to feed your baby as soon as you can. So for me, 12 weeks, my supply went really low, really fast, and so if you can intervene earlier, then the baby can gain weight faster. Because a lot of the symptoms for the baby is like low weight gain. They're diagnosed with acid reflux, and then they're given medications for that instead of looking deeper into what's causing the acid reflux.
Can that be caused by being tongue-tied?
Yes. So
acid reflux?
I don't think they really are. They have acid reflux. I think it's because when they're tongue-tied, their tongue isn't going to the roof of their mouth, so it's not forming that seal that it needs to. And it's not just tongue-tied; you could be lip-tied too. So when the lip doesn't fully flange out and go over the breast, then you're not getting that seal as well. So when you're not getting that seal, the baby is swallowing a lot of air, and that's what's causing that acid reflux, for them to spit up a lot, for them to have a lot of gas. You'll see foam in their stool just because there's so much air that they're ingesting.
So if a pediatrician was to miss this, and then, when's the first time that you would see a baby? Or because you're not going to see, unless someone comes in for tongue tie specifically, you're not going to see an infant that has no teeth, right? So it could be
right. I don't see kids, really until they're 18 months old.
And then when you see that, though, have you seen cases of this tongue tie or lip tie that have kind of like gone on to this point?
Yeah, you do. So there's certain stages. So when they start eating solid foods, they can't. Babies that are tongue tied can't, or children, toddlers, don't like textured food, so they have a hard time eating. They're very sloppy with eating. As they get older and they're learning how to talk, they have like a speech impediment because their tongue is tied. So they go to a speech pathologist, and then the pathologist might refer them to someone who can release their tongue.
But would they know? You know what I mean? If they get to that specialist, do they go, oh, I can see that there's an issue in the back, in the posterior?
So, there are some really good specialists, and this is one thing I have found out with tongue tie. It is very much a group effort. There's speech pathologists, there's chiropractors, there's bodywork specialists, there's lactation consultants, there's a dentist. I feel like my job is the easiest because releasing the tongue is not difficult. It's just what happens afterwards. There's a lot of stretching and exercises that are involved with that so that it doesn't reattach. And then if a baby doesn't get released right away, they will try to, we as humans will try to eat no matter what. We'll figure out a way. So they compensate. And then when they try to compensate to eat, they change their body, they change their form. So that's when chiropractors and bodywork specialists will come in and kind of intervene with that.
And it all kind of starts and ends with your mouth.
Yeah,
really.
yeah.
I mean, all these conditions we're talking about are, your mouth is so important in aiding digestion even, or just speaking.
Yeah.
So when you see this, what is the treatment for that? Like, you do this in your practice. You do tongue tie and lip tie. Can you kind of break down how that works, like how you treat it?
So we use the CO2 laser, the Saurer laser, and I prefer this laser because it basically just evaporates the tissue. Some other people will use, and this is not a bad thing, but you do have to be trained very well with a diode laser.
That I have heard of.
The diode laser.
But that is more of that's an older school technology versus
No, a diode laser is great for different things. And honestly, one of the doctors that I shadowed did use that, and he's highly regarded. But it doesn't. It's technically not a laser because you have to initiate that laser with cork or black paper or something, and then by doing that, it becomes basically a hot piece of glass that cuts. It cuts with heat. The diode laser. The CO2 laser that I use is actually, I kind of discussed it with other things. It absorbs, so gum tissue is made mostly of water and collagen. So that wavelength that CO2 laser puts out, it's absorbed by that tissue and it basically evaporates that tissue. So there's less bleeding. You don't have to use anesthetic on babies, which is really important. You don't want to have to put your newborn baby under and go into sedation just to have this procedure. It takes seconds. It just evaporates that tissue, and it just forms a diamond-shaped wound on the baby. And then I talked to the mom.
I think we need to say different than wound. Like, that is what it is,
yeah,
but
it is. Well,
that sounds terrible.
Well, what do you want to call it?
Just a little, an ouchie, maybe.
Okay,
to
a
be
diamond-shaped
professional.
ouchie.
Yeah, I don't want to say wound and baby. That just sounds wrong. I didn't mean to interrupt you, but that was just terrible to hear.
I've had a lot of dads that, they stress about having, it's a very stressful thing. You are handing
I'm getting stressed out about it, and my kid doesn't need it. And I'm just thinking,
yours is much older, right? Yeah.
Well, she's 11, and if she can't talk right by now, it's not going to happen. So we can give up on that. But she's really big, so she's not having problems eating. Let's put it that way.
She's 11 grown. She's very tall.
She's a monster. She's baby Shaq. But yeah, I'm sorry. I was taking you away from your wounding children.
Yeah, so they have a little ouchie and they have to stretch it. Yes, and it's a diamond shape. And, wounds, I have to say it.
Okay.
In the mouth, when they heal, I always say the scab looks white or yellow. Sometimes the baby has jaundice. It kind of looks yellow-orange. But that's just normal. A lot of people kind of mistaken that for an infection, so I always have to kind of put that out. But the moms will have to do these stretches on the tongues and sucking exercises and stuff for at least 4 to 6 weeks until it completely heals. But even then, sometimes it can reattach, and it's just sometimes biology happens, I don't like to put blame on anyone because these things happen, and you just kind of want to keep on doing things that will help the baby, like going to see a bodywork specialist then, or a chiropractor or anything like that.
I've heard of that because we actually have there's a show that we do with another chiropractor who was talking about working on infants that were having problems with digestion.
Yeah.
But it was before you and I had this conversation about tongue tie, so it all kind of...
If
you follow all the shows we're doing, I think we could put it all together and I could figure out everything about the human body. Like if you get in a car accident, see this chiropractor and get your mouth done and get your teeth whitened.
Yeah.
So along those lines, so the nutrition part of it is where I'm looking at it. Not just the speech impediments that could develop.
There's a lot of things that's involved with tongue tie, though. So,
but I would think the nutrition part, you had mentioned this to me before a few weeks ago when we're having our fun conversations off the air about tongue tie, is the nutrition part, the aspect of like a child's growth cycle. If they're not getting what they need, the calories and nutrients, you're stunting their growth. And you're not doing it on purpose because you don't know, but you do. If you have this issue, there is a way to take care of it and change it.
Yes, I've had several babies that were diagnosed with failure to thrive, and
what does that mean exactly? I mean I know you told me, but
so I've had 2 months old, like where they look like they are not growing. They
like
look like a newborn baby.
Or?
They look like a newborn baby, even though they might be 2, 3, 4 months out. So like they're just not growing. But I hate that term though because the babies I've seen don't look like they don't want to live. They're just not gaining weight.
They don't even know that if they want to or not.
No, they're just not gaining weight. They're not getting the nutrients, like you were saying.
But that is a lot of that is caused. I mean, even if they weren't breastfeeding, they're still going to have problems, right? If they change the formula, because you're still having the issue you can't process this correctly.
Right. You still have to form a seal around a bottle, even if it's not just breastfeeding.
So when you see that, like, can you diagnose, like, when you're looking at a baby? I don't mean that you can diagnose from 50 yards away, but if you see a child that's having nourishment issues, like, that's probably the first thing you look for, right?
Well, you can see a lot of different things. So you can even just look at a baby. If they have a certain head tilt, like they favor one side.
I like that you're tilting your head while you're talking on the radio.
I'm showing it to you.
Right.
They have a lip blister, so they have blisters on the lip because they can't form a seal. You know, if they're very congested all the time and the mom, like, they wake up congested, it's because the milk is going into their sinuses and not down their throat because they're not swallowing it properly. So those are just limited things, you know, and then obviously the mom has to deal with her own symptoms as well.
But there are some telltale signs that you see and you're like, oh yeah, this could be an issue.
Yeah.
Tell you what, let's take a break right now because we've been going on tongue tie for almost 16 straight minutes.
I know.
And people are loving it. Yeah, we're going to come right back, though. You're listening to, I'd say I got tongue tied right there. You're listening to the River Park Dental Show. We'll be right back.
There's so much on this topic.
I know. I want to keep going. Like, you're doing great. I'm trying to let you keep going. I just want you.
He got tongue tied.
Well, the other thing that it affects, it's like on the dental side, you know, your palate's high, so people need braces because they get crowding. They found that it causes sleep apnea in kids because their tongue is pushed back into the throat so that they can't breathe.
Can that be something as an adult also?
Yeah.
They can't breathe properly when they're sleeping, so they keep waking
their tongue
up.
basically is kind of
Can't get a restful night's sleep.
They can't thrust it forward, which is normal. So that just kind of puts it back. And then they've found that, like, kids that have sleep apnea there's a correlation between sleep apnea and ADHD because they're not getting enough oxygen in their brain, and then they're acting out of it.
That makes
crazy.
Sense.
Yeah.
What about if they were in a car accident and a chiropractor treated them and then they had the Saurer laser and then after that they could get gardening tips? What? Can we just tie all the shows together?
Yeah. And they could rent a dumpster from Frog Hauling.
See, and someone could work on their kitchen with Big Sandy.
And if they got into a car accident, they could get justice.
Yeah. See, we really need for this that someone has to get in a car. A baby has to be driving a car. Get in a car accident, then we can put it all together.
And then Madison can help them with their accounting.
Madison can do their taxes.
Exactly.
Okay.
There we go. It's all tied together.
All right.
You guys left the buzz out.
No, he was a chiropractor.
Oh, okay.
Oh, well,
either him or Dr. Dan.
Oh, yeah. Then that baby can grow up and get married, and Jeff can sell them a ring. Yeah, perfect.
That's it. Jeff and Scott could sell them a
then
bright crystal diamond.
And when they're fighting and their marriage is going down the tubes, then Buzz can put the guy on hormones, and then he can meet the love of his life.
Put the guy.
We've tied them all together.
If they're having problems when they're in their 40s, he can put them both on hormones.
Right. I was told to stay away from. I kind of want to get into that though. Yeah. I kind of want to bring it up.
I'll walk.
Yeah, because I don't know how far we can go. Yeah. I just want to bring it up.
We got about 10, 11 more minutes.
My training.
Okay. What's that?
Did you not read the email? My training.
You're saying training.
Training.
Right.
I took a lot of classes on.
Right, but it says the list thing says tread lightly there.
Oh yeah.
So okay.
Yeah.
Okay, I'll hit it. Hold on. All right, bring us back.
Ready?
Yeah. Welcome back to the River Park Dental Show.
Phing, before we went to break, we were talking. This whole show has been about tongue tie, and this has been fascinating. But I thought what was really important today is I picked up Columbus Parent Magazine, and you have an ad in there.
Oh, yeah.
Okay? So you're looking for children, obviously. But what was more important is I saw one of the guys in the ad next to it was a stay-at-home parent and a poet.
What?
I just wanted to point out what I'll be doing. And that your ad is in there for Columbus Parent.
Oh, okay.
But it also did mention that you treat infants and children. Yes. But when I saw stay-at-home dad and poet, that was what
really piqued your interest.
Yeah, I stopped paying attention to your thing, and I had dreams of my own. Now let's get back into tongue tie because we only have about 9 minutes left, and there's so much to go into. Right. This is like this is like day one I met you and was talking about this.
Part 2 of this.
Now, if somebody wanted to find you to do this? I know there's some list out there of people that do this.
Right.
Let's ignore the list for this point, because what I would hate as, I don't look at this as consumerism. This is, I want to get my child treated. If somebody wanted to find somebody that takes continuing education and training classes on this, I mean, where were you just at that you took this training that you were texting me that it was one of the most boring things you've ever done?
Stop. I was in Austin, Texas.
There you go. So
Yeah.
you were in Austin, Texas.
Yeah.
You're at training, but you are kind of on the forefront with technologies to handle this stuff, but you're also well versed in this. How does somebody get to you? Like, how would somebody bring their child to you? How would they know to bring them to you?
Well, it's tough. I mean, so there is a list out there, and it's a list of doctors who I think are great. They do a fantastic job, and it's a good place for parents to start. And the reason why that list happens, because there are people out there that don't do the proper training, that maybe do incomplete revisions. So I think a lot of times, you want to be very selective and because these are babies that you're treating.
Well, it's a very sensitive thing, too.
It's a very
if you get it
sensitive, very
wrong,
serious.
it's
yeah,
bad.
Right. But with that being said, there are a lot of well-trained, good doctors out there that aren't on that list as well. And I've met several of them. And I just think that there should be more options for parents. Because, if you have to drive 2 hours, all I know is when a mom will do anything to feed their baby, whether it's driving 2 hours, paying a certain, these higher fees because they want to feed their baby. What I have found, though, is with this list, it does limit, because the parent wants to see the best, which they should, but there's also a long wait list to see these doctors. It can be 2 weeks to 2 months. I only breastfed for 12 weeks, so if I waited 2 months, it's over. It's
Right.
done, So I think we should provide more options for parents and moms out there.
Well, and if you have to wait to get on this list, if you have to wait 2 months, that's a lot. That is in that growth cycle for a baby. That's a lot of time.
Yeah, right.
So
right.
you can't create more time. You can't go back and fix it. And
I think 2 weeks is too long.
Right.
So.
But if somebody heard you talking about this right now and they said, "Well, my kid, I think that's the issue," do they have to wait on a list, or can they come to you?
No. So we will see patients.
Wait a minute, you have to, because
No,
you
they don't
said
have to
no to
wait.
both.
They'll
Okay,
have to
that's what I
wait.
mean.
They don't have to wait. So we will see them right away, and we will do treatment the same day if they want to do it. And we charge a very low fee. So the average fee that I've seen across the country is $600 to $1,400, and most of the time that's out of pocket.
It's not covered by insurance.
Medical will cover, however, a lot of dental offices will not bill your medical insurance.
Okay.
So to make it easier, what I have done is my cost is $375, because the last thing a mom needs to do is come out and worry about this huge bill to help.
When
feed her
also,
baby.
who wants to do it, like get a Groupon for it? I mean, you want to
but
find somebody who can do
someone
it,
who's
but
good, who
that's not going
has-
to take advantage of you.
Right. But then we also bill medical insurance. And that's important for me too, because you don't want to hand a piece of paper and say, you need to figure out how to bill your medical insurance for this, because we're not going to do this for you. I mean, come on. I feel like this is just basic things that we should do. And it's, if you want to be seen quickly, and paid a low fee, and also let us bill your insurance, then you can definitely come see us.
The tough part, I would think, is if you were not a dentist or a physician, like, you have an advantage. You have a radio show, so you can talk about these things.
Yeah.
If there was somebody that was, within 10 minutes drive, that was a physician that I could go see, but I didn't know that provider could do it. I mean, you gave the example of someone having to drive 2 hours to someone they don't know, that they've not done business with, and that's not going to be your provider moving forward. You don't really have a choice when you're going on a list.
Right. And we actually have one patient. She drives an hour and a half to come see us. She lives in Dayton. But we could see her today. So that's why she took, otherwise it was today or 2 weeks or 2 months. So she chose the hour and a half drive to come get
But
her
see,
son
that would
treated.
make sense to me. It doesn't make
Yeah.
sense, though, because when we're talking about this list, you're on that list, and then it's when it's your turn. It's kind of like being at the BMV. You're going to sit on this thing until your number's called, and then here's where you're going to go. Right.
Well, they make an appointment. So the list is this. It's a preferred list of providers.
Right.
And they call these providers and they get put on a waiting list. Yeah.
But you're just funneling them, and it's when it fits in their schedule, because that's not all they do.
Yeah,
you know,
and
they
I've
have
seen
other
a lot
things.
of times on the forums, mom will say they got a call that they got canceled because the doctors couldn't fit them in. Or
Right, they're
like
sick,
that.
or there was something ran over. But that's what I'm saying. If somebody needed that procedure, you can do it, and it's not. They don't have to wait on a list. They can just call and make an appointment. They can't just walk in.
No, we can't. We don't do walk-ins, but yeah, we will take you. I mean,
It's not a hair place. You can't just walk in, put your name on the list. I wanted. This is going to be hard to do, but I think you can do this. I wanted to kind of talk about associations with this, because you talked about during the break. We talked about the issues that come with this, which are, you know, kids that eventually need braces because they have crowding, because the way that they're not able to suction and eat properly. But then you can pick and choose which one you want to do. The one I really would like you to do is the sleep apnea part.
okay. Yeah, so what they have found that for sleep apnea, kids that cannot thrust their tongue forward because it's tied, their tongue basically lays, when they're sleeping, right in the back of their throat, and it's obstructing their oxygen, getting oxygen when they're sleeping. So it's not, sometimes I think people think sleep apnea, oh, they're overweight or whatever, and it's just not always the case. So in some cases, they are tongue-tied, it's causing sleep apnea. And there have been some studies that have shown correlations between kids with sleep apnea, basically not getting enough oxygen while they're sleeping, to ADHD and having issues from that.
That was the key, is that when you see all these commercials for the sleep apnea stuff, and then the reports of ADHD, I don't think we're connecting that a lot of this has to do with your diet and the nutrients you're taking in, right? Again, it all kind of starts with the mouth.
It could be that. It could
I
be
mean, not every
tongue-tied,
single
it could
case,
be
but the tongue tie would be a big deal if it's not diagnosed, and then you have braces and crowding issues. I just find it fascinating, the things that you're able to kind of, like, as you're pulling this out, because you're kind of giving the roadmap of if A plus B equals this is your outcome.
Right.
And a lot of it starts with something simple like tongue tie.
Yeah, it can. And tongue tie can affect a lot of things. Your posture, like he said, ortho.
Are you saying that because I'm
decay,
slumping over?
Yeah.
I was looking at the clock. I just
But
didn't see
the tongue is a large muscle in the body, and you need to really exercise it. And you know, when it's being restricted, it can affect every part of your body.
That's why we do the show. We're exercising it. Tell the people how they can get a hold of you, not just for tongue tie, if they just want to come in and hang out.
Yeah.
You guys are throwing out those Sonicare toothbrushes like crazy. If you're looking for a new dentist or just looking for a friend, Phing, how could they get a hold of you?
They can come to our office at the New Bridge Park location, 6605 Longshore Street, or they can call us at 614-689-8686, or visit our website at riverparkdental.com.
Okay, that's going to be it. Why don't you sign us off for the week, and then you can tell them that we'll see them next week, because we will.
Yeah, we will see you next week.
That's riverparkdental.com.